Hello, everybody, and welcome. Thank you for joining the Systems for Action RESPROC webinar. My name is Chris Lytle, and I'm Deputy Director of Systems for Action. Systems for Action is a national research program of the Robert Wood Johnson Foundation, housed at the Colorado School of Public Health. We support studies examining multi-sector collaboration across medical, social, and public health systems with the goal of improving population health and advancing health equity. So today we'll hear from an S4A project led by researchers from the University of North Texas and University of Utah, who I will introduce momentarily. The presentation will be followed by commentary on the project, and we've saved some time at the end for questions. So if you have questions for our investigators, please enter them in the Q&A box at the bottom of your screen, and we'll have time to answer them at the end. All right, so I'll introduce our presenters for the day. Hee-Sun Yang is an associate professor in the Department of Public Administration at the University of North Texas. Her research explores nonprofit and government partnerships, collaborative governance, and nonprofit sector in South Korea. Jesus Valero is an assistant professor in the Department of Political Science at the University of Utah. Jesus's research explores government nonprofit partnerships, effective leadership in nonprofit organizations, and the use of impact of technology in public service. And our commentator for today is Michelle Flynn. She served as executive director of the Road Home since February 2020, having been with the agency for 25 years. She has a master's of public administration from the University of Utah. And with that, I will hand over the controls to our presenters for the day. Be sure to add any questions you have as they come in the Q&A box at the bottom of your screen.
Thank you, Chris, so much about your very nice introduction of our research team and Michelle Flynn and our commentary today. So I am Hee-Sun Jang, and I'm with my research colleague, Jesus Valero, to talk about very important topic of serving homeless population in a time of COVID-19 pandemic. So we, Jesus and I, have been very much intrigued by this community-based approach to serve our homeless population, namely Continuum of Care service networks. That is about this effort to reduce these fragmentations among the key service industries and improve effectiveness of coordination in service of homeless populations. So for this grant opportunity, Jesus and I wanted to study the impact of COVID-19 to our homeless population and understand how this system for action, right, the continuum of care is addressing and supporting and responding to these kind of unprecedented impact and challenges of COVID-19 to our homeless populations. So today we will talk briefly about the homelessness in general in United States and in its impact to the impact of pandemic to our population. And we would share our research goals and how we want to achieve with the timeline. And there has been good level of kind of initial data collection by contacting key research service providers that will be shared. And we want to achieve your advice, wisdom, and experience for our less to the 2 year, the 1.5 years of research project. So let me see. Yes. Great, awesome. So I want to have a very brief moment to talk about homelessness in general that was reported by point in time data of 2020, which was the step behind before this hit by the COVID-19, and it was little like quite depressing to see this increase of 2% of the population from our home, like of the count, and that is fourth consecutive year that is showing the increase of this, like the homelessness here in like the United States. And this increase is mainly driven by the increase in unsheltered population, that like of the total of 7% increase. So you are seeing individual 7% and families with like the children are 13%, and the 6% increase in veterans homeless populations who are unsheltered. And the demographic kind of picture of our homeless populations are overly represented by Black population, Hispanic, Latino, and indigenous like the people. And with their location, where they are. So more than half of homeless populations are located in 4 states: California, New York, Florida, and Texas. And more than quarter of homeless populations are located here in LA and New York. And more than 70% of California homeless populations are unsheltered. So this is just very brief snapshot of our understanding of our homeless population that was coming from our point in time data. Okay, let me. Sorry, I mean, I can't really see that the arrow to move. Carrington, can you help me to move to the my? Okay, there you go. Sorry, very sorry. Okay. Okay, there you go. Sorry, technology. So the demand of service of homeless population in the time of COVID is recorded big time about their general nature of vulnerability, who like the high rates of people who has existing conditions, and their like the residential conditions in congregate like the shelters, and also their kind of like these homeless populations are less likely connected to the stable healthcare systems. So in all of these CDC directions and guidelines for the shelters were clear to offer the services even for the people who are tested positive. But without really preparing our service providers much of the resources to offer these services at the early of like the March of 2020, because this nature of funding to the homeless communities were more focused on this housing first initiative that is about providing like the permanent housings via this like the continuum of care service networks. So these vulnerable conditions of homeless population demand quite much of service resources that has to be offered immediately right away, because they have a higher risk, many of them are high risk category of COVID-19 infections, and their living conditions, even there in the shelter, or was quite easy to get infections, and there has been observed outbreaks in many of major shelters for the homeless population across the year of like a year and more of the time. And also we are seeing these outdoor living conditions and living in encampment it's just not appropriate for the people who can properly protect it from infection of COVID-19. But there has been just anecdotal observation of much high increase of the unsheltered population because they are very afraid to go to the shelter because of their fear of infection. So they, if the weather is okay, they want to just hide themselves to the wooded area, or they want to stay in encamped communities. So homeless populations have the issue of home and stable housings. And in the time of like a COVID-19, your shelter and the home is the most basic protection of you to be stay away from the infections. So the communities, like local community, had to identify and provide these shelter services and resources for our homeless population. So they had to provide overflow sites because the quite a dramatic reduction of shelter bed due to this social distancing, social distancing kind of instructions, and they have to prepare isolate site for the close contact patient, and they have to provide quarantine site for the confirmed patient, and they have to provide protective housings for the people who has severe health conditions to reduce their infection and potential kind of issues of severe illness caused by the COVID. So we have we have examined, there are some key service approaches in service of the homeless populations, and so they try to provide the testing centers there in shelter, and they want to offer this testing services by outreach team, and try to create a quarantine space for the homeless patient, and by securing motel and hotel. And some of the cities and the CoCs are creating this RV park that is for these quarantine services for people to stay 2 weeks or more than 2 weeks of the time. And they use the technology to connect the homeless patients by offering these like the telehealth for them to continue their access to the public health. And there has been issue related with the vaccinations because homeless population, from our observations of the state eligibility decisions, homeless population was not the population get quite much of attentions. They only handful of states indicated congregate setting as a eligibility of phase 2 or phase 2 and B, like 2-B. But other than these handful of states, that many of states had their special plan to vaccinate their homeless populations. And there is there is a report about access barriers, because homeless populations are the population less likely to have proper record and the proper internet access and carrying the stable like the smartphones to get them to register and get their vaccination done right. So there has been important vaccination equity issues and the and the issues of access of the vaccinations. And another important service approaches that was observed was the prevention effort to expand these eviction moratoriums and offer rental assistance. And those resources are mainly coming from CARE Act and CARE funds support to the cities and counties. And I want to hand it to the Jesus for the half of this presentation. And
Fantastic.
I will do the move right.
Yes, please. Thank you so much.
Okay.
All right. So thank you so much, Dr. John, for getting us started this morning. And so we were interested in starting to just get a close look at the rate of infection and testing of homeless population in terms of the COVID-19 And so one immediate challenge we had was the lack of aggregate data on the rate of infection, testing, and vaccination of the homeless population. Communities are not necessarily expected, for example, as part of the point in time process to necessarily report some of these indicators. But some communities are trying in terms of trying to track those positive cases and other important critical data points in order to understand the magnitude of the impact that the COVID-19 pandemic is having on this very vulnerable population. And so we identified a couple of communities that are doing an amazing job in providing a sense of the spread of the COVID-19 virus among the homeless population. And among those are Salt Lake County and Los Angeles County. So for example, in Salt Lake County, a total, as far as of last week, for example, a total positive cases of 966, about 117 hospitalizations, a total of 994 vaccinations of the homeless population, with an overall total homeless population based on 2020 data of 1,958. So a small portion of those positive cases are turning into more severe cases where they're needing to be hospitalized. LA County, on the other hand, a total of 7,107 total positive cases, with about 19% of those entering hospitalization to receive critical medical services to manage the effects of the virus. We didn't find a total vaccination rate or data for LA County, and a total homeless population of about 63,000 based on, again, 2020 data. So again, just a brief snapshot of the spread of the COVID-19 among the homeless population, and the reality that not necessarily all communities are tracking these positive cases and important data points. So with all of this initial introduction, we are incredibly grateful to the Systems for Action program within the Robert Wood Johnson Foundation for their support of our research interest in wanting to learn more about what has been going on in terms of the effects of the pandemic on the homeless population across the US, with specific attention to the Continuum of Care service networks, which we are using as an important system alignment strategy in order to bring these various service sectors into working together, coordinating, collaborating to reduce the incidence of homelessness. But in the case of specifically the COVID-19 pandemic, their ability to provide critical services, medical services, healthcare services to an already vulnerable population during this, testing times. So the research questions that are leading this specific project include, number one, to what extent and in what ways is the COVID-19 pandemic causing challenges and disruptions within the CoC service networks in communities across the US? So what specific issues, challenges, gaps are they sort of experiencing as a result of the pandemic is our interest here. Number two, how well are CoC homeless service networks performing in addressing the broad health and human service needs of individuals experiencing homelessness during the COVID-19 pandemic? So to what degree are they still being able to provide access to critical health and human services, providing treatment, being able to vaccinate and provide mobile testing and things of that nature during the pandemic are key parts of this particular research question. And then lastly, what are the key factors affecting the success of these networks in reducing health disparities and improving health equity? So we want to know what conditions are leading some of these communities to be more effective, more successful in being able to reduce not only the incidence of homelessness, but more importantly, being able to create access to important healthcare services and other human services in order to withstand the effects of the pandemic and reduce any kind of challenges there. So our approach to this research is using a mixed method approach. And so we are starting with, our grants began in November of 2020. So we are just a few months into our research project here. And so we're starting by first just getting a thorough understanding of our current policy context in terms of homeless services and the approaches to reducing not only, again, the incidence of homelessness, but the access to healthcare during this sort of trying times. And so we're taking a close look at the American Federal Rescue Plan Act of 2021. We understand there's some resources there targeted towards specific, service areas. So we want to understand more about the impact that that's specifically having on communities being able to pool resources to address the challenges of the pandemic in terms of their homeless population. We've been studying state laws and plans, specifically plans to vaccinate and other sort of critical plans to respond to and address the challenges related to the pandemic, and also a close look at local actions to understand how local governments specifically are working to respond to the COVID-19 pandemic. Then we're moving on to, and this is where the stage that we're currently beginning to take on is a case study of CoCs across the United States. We are interested in interviewing CoC leaders, healthcare managers, government agencies, and others in order to develop a deep understanding of how communities are being affected by the pandemic and understand their innovation strategies and ways of coping and withstanding the effects of the pandemic. So as part of this exercise, we've just began having conversations with CoC leaders across the country in order to get an understanding of where things sort of stand, to then move forward with conducting more systematic case studies of specific CoCs across the country. What we learn out of this process is what we're hoping to be informing the development of a national survey that we're going to be launching in 2022. This national survey will be targeting CoC leaders, shelter organizations, and managers, healthcare centers, in order to build a systematic understanding of the impact that COVID-19 is having on these critical organization, but more specifically on the system alignment strategy of the CoC in coping with the effects of the pandemic. Okay, can we move? Whoops. Sorry about that.
Sorry about that. I can see the, sorry, I can see the, okay, there you go. So not showing the arrow.
There we go. That's perfect.
Oh, sorry.
There. Thank you so much. So we began by having some early conversations with CoC leaders in Dallas and Salt Lake and Sarasota, Florida. And these have been incredibly useful and important in getting an early understanding of where things stand in terms of how the COVID-19 pandemic is having an impact on these on this important system alignment strategy for homeless service provision. And what we're learning, a couple of important points here, is that the CoC system, as an alignment strategy, again, in bringing the various sectors to work together to address challenges around homeless population, is that they are one of multiple key players in the response effort. And so what we're seeing is that the CoC network, along with county governments or local governments, the state elected officials, philanthropists, and others are also playing an important role in the recovery and response effort to the pandemic. And so this sort of manifests a really interesting reality about the importance of CoCs working in collaboration with other stakeholders beyond just their system alignment process, in bringing other important players to respond to the effects and challenges that are brought upon by the pandemic. And so we're intrigued by this reality and want to explore this more to understand how that process is going, and how that collaboration is working out in terms of being able to build a much more systematic, comprehensive, collaborative effort to responding to the effects of the pandemic. Number two, local governments, particularly counties, we're learning are playing an important role in leading the pandemic efforts across the country. We're seeing this from our conversations with these leaders, but also from evidence in the media, from reports, from early studies, white papers, showing that counties specifically are playing an important role in leading conversations, in starting those conversations, in bringing parties together in order to pool resources and strategies to respond to the local needs brought upon by the pandemic. Number three, the coordination across the sectors is helping communities house the homeless and provide for their stable care. And this is super, super important to see that the COC system as, again, an alignment strategy is working in bringing these various agencies from the public health, medical health, and human services sectors, government sectors, nonprofit sectors, in working together to go beyond their organizational boundaries to support the needs that are being brought upon by the pandemic in this various sort of vulnerable population. Number four, the vaccination of the homeless is not necessarily a state's priority, I'm sorry. We're seeing that in our review of vaccination plans across the country that very few states are making specifically homeless populations a state priority in terms of access to the vaccine. And lastly, we're also sort of getting a sense that the level of coordination beyond just coordination may be challenged during the pandemic due to organizational focus on survivability. We're seeing that there is coordination happening across communities in terms of, having communication, being a part of a response team in the local sort of area, but the focus still remains on trying to maintain your or their specific organization they represent to stay alive during this pandemic. So we want to know more about the degree to which, beyond just coordination is actually taking place, the degree to which collaboration and networking is still happening across these communities in order to withstand the effects of the pandemic. So another important observation from these early listening exercises. So in year one, and again, this is a research in progress webinar, so we don't necessarily have full data to report out yet. But in this first year of our research program, we are focused on these case studies of these Continuum of Care service networks. So we're planning to engage specifically 15 to 20 COCs across the US to understand the challenges and needs that are created by the pandemic. And so we're looking to specifically interview representatives of the medical, public health, social service sectors in order to get a much more comprehensive picture of what's really happening within those local communities to build then a more systematic understanding across this qualitative data to get a sense of how the pandemic is sort of having an impact and influencing the services, the realities that are facing those particular communities in the time of COVID. Then we're planning to use these interviews to build on this qualitative understanding and inform the creation of a national survey. And here our goal is to identify as more specifically the effects of the pandemic, and as importantly, the factors that are explaining the successful adaptation and resiliency of this important system alignment strategy to the effects of COVID-19. So we are very aware of some of these data collection challenges, but we also see some opportunities. We know that the PID data, the point in time data to HUD, specifically during the 2021 cycle, has been modified in some communities or canceled altogether. And so this is going to create some challenges in us understanding a really thorough and a little bit more of a complete picture of the degree to which homelessness is a challenge across communities, and realizing that some of these numbers may be underrepresented in those sort of areas. But in terms of like data opportunities, we're really sort of seeing that we have an opportunity to really collect unique data in terms of COVID testing, care, and vaccination. And so if we know some communities are proactively gathering some of this data. And so it's really going to help in getting a sense of the factors, those conditions that are leading some of these communities to be more proactive and effective in responding to the pandemic from the public health sort of perspective. And so we are really open to collaborative opportunities from any of you out there who are proactively also gathering data in these sort of domains. And we'd love to hear from you and about possibilities of working together to build a more comprehensive data set to get a sense of the effects of the pandemic in these particular areas of work. So moving forward, we are working towards publishing a public report of our case study research at the end of the year. So please stay connected with us, and we'd be happy to share that report as it becomes available. And our goal is really just to get this information and data out as a set of best practices, as a set of knowledge creation, of information that can be immediately digestible and disseminated to our local communities across the country. And so please keep an eye out for that report and stay connected with our project. Then we're launching this national survey in early 22, targeting specifically COC leaders, public health agencies, government managers, and others. And so if you'd love to be a part of that process, please let us know. We are working to identify those contacts through public information provided through the HUD Exchange website that provides contact information for these various COC systems across the country. And so please keep an eye out also in case you're working within a COC for an email and communication from us about the possibility of working as part of that national survey. Again, that we're looking to launch in 2022. And then we're interested in building a data set on the effects of COVID-19 on the homeless population, and are certainly open to collaboration opportunities, specifically, wanting to work with researchers and others who might be already working in this area or have an interest in this, in finding data relating to the rate of infection, hospitalizations, vaccination, testing, other key indicators that can help us develop a comprehensive picture of the challenges and effects that COVID-19 is having on the homeless population, specifically here in the US. So again, please stay connected with our project and research reports via the Systems for Action website within the Robert Wood Johnson Foundation. Our project has a specific site, and so in this site, we'll be putting some of these public reports, publications from journals and other key pieces that are coming out of our work. And so we'd love to connect with you and share some of that information as it becomes available. All right, thank you so much. So now we're going to have Michelle Flynn, who is the Executive Director of the Rudd Home, share some thoughts and commentary on this research project.
Thank you, Dr. Valero, Dr. Zhang. Thank you for inviting me to participate with you on this webinar, and thanks to Robert Wood Johnson Foundation for supporting your work. I have a few things I've made some notes to cover on the commentary, and I want to keep close to the time because I know questions are going to be important. I wanted to highlight a couple of things that were mentioned already, and that is the work of ending homelessness is absolutely a cross-sector partnership. So important that we work across our sectors and include the people who are part of the homeless services system in those discussions on the system and community level. What we have found, and it's been highlighted this last year with the COVID-19 pandemic, really is, as Dr. Valero said, not just coordination, but really partnership. On a deep level, it's the only way that we can move things forward. And that includes a lot of time. It includes time in meetings, time in discussions, getting together and planning. And one of the things that we experience in the work that we do is that we work in a field that is crisis driven. We're working to save lives every day. We are working to bring people in out of the cold. We are working to get people into stable housing. And we as nonprofit organizations and government entities, we need to make sure that we are making the time for those partnerships and for those meetings and collaborations. And moving beyond the, oh no, not another meeting conversation, to really getting together and showing up, because the information we have is essential. And we know that when we are not part of those conversations, then the solutions are not going to be as impactful. So to that, I want to speak second to just the value that Dr. Valero and Dr. Zhang have brought and have brought in prior studies as well to our work. Having partnerships with universities, I think is such a critical piece of our work. To do research, to do evaluations. I know a number of projects that we have done at the Road Home. We've partnered with the University of Utah, a couple of different departments, to serve as the evaluator for our programs. And that's the way that we are able to get really good data on what's working and not working, and improve our programs and improve our systems. And then the third area I want to touch on is just really building on this discussion of partnership. And I cannot say enough about Salt Lake County Mayor Wilson and her team, and how they approached homelessness during the COVID-19 pandemic. When Mayor Wilson created her COVID-19 command center group, she included the vulnerable populations as a subgroup of that, and Deputy Mayor Aaron Litvak was put in charge of that subgroup. And from the beginning, the needs of people experiencing homelessness were part of the discussion. And that was definitely a result of work that had been done previously, the partnerships that have been done in building our Salt Lake Valley Coalition to End Homelessness, and the relationships that we had built. And so just briefly want to mention how important that was to us to be called together as a focus group in early March of 2020, and understand that we were going to have this direct connection. From that time, we have had, at the minimum, weekly meetings with Salt Lake County and with the Salt Lake County Health Department, including all of the shelter providers and the 4th Street Clinic, our homeless healthcare partner here in Salt Lake. Having that communication is essential. As things evolved and we were able to provide information to them and propose things and propose perhaps some new things and challenge them a little bit to move out, maybe even ahead a little bit of the CDC and the recommendations that were coming down. For example, we at the Road Home started doing screening at the front door on April 1st of last year. And we were getting hardly anybody who indicated that they had symptoms. And our communication back to Salt Lake County Health Department was, listen, the folks that we shelter are used to not feeling well. They've been transient, they've been in and out of shelters. They, when we're asking them about their physical symptoms, they're saying they're fine because they're just used to not feeling well a lot. And they're also don't want to engage on a deep level, and they don't know what we're going to suggest. And so we wanted to have testing on site, even though we had not had cases show up in our facilities. And so we went to them and talked about this. And so that conversation was happening even before there was much direction from the CDC on how to work with congregate homeless shelter facilities. And in Salt Lake, we have shelter facilities that shelter 200 to 300 people a night in mostly congregate dorm settings. And so with that discussion and the health department actually coming down to the shelters and looking and observing and hearing from us about how the movement was in a facility and how the beds were used and the challenges with this disease being so contagious, they were able to give us recommendations on how to change the configuration of the dorms and the way that we sheltered people. That was significant. And at the same time, they recognized that we alone couldn't create isolation and quarantine facilities within the properties that we were using for shelter. And Salt Lake County funded a motel program for a non-congregate shelter option and stood up the Q&I facilities, the quarantine and isolation facilities. They selected locations. First, they were county-owned properties, and then they were hotels. And the Salt Lake County Health Department staffed those quarantine and isolation facilities. So when we did get the testing on site, and we did have some surges of COVID-19 at the different facilities over the years or over the months, we worked on a daily basis, and we transported people immediately to those locations and got them out of the shelter. And I truly believe that has had the biggest impact on us not having a really terrible breakout amongst our population. I know that Dr. Valero went over some of the numbers from Salt Lake County. Last week, we had 13 active cases in the homelessness system. And for many weeks, we had just a couple, and a number of our shelters haven't had any for a while, with over 1,000 vaccinations happening already in our community. And the health department and the forestry clinic coming on site to the shelter locations because they heard and understood from us how challenging it was for people experiencing homelessness to go to the vaccination sites. So I'm probably already getting over my time, but I just wanted to really highlight how that system level information is so important, how grateful we are for the research and the evaluation of what's working and not working, and how important it is for us to be able to look at that in order to make this system improvements and to bring the other sectors to the table so they recognize their roles as well. Turn it back over to you guys for questions.
All right, I guess I'm on. Thank you so much, Michelle, for giving us a little bit of context and background. And of course, thank you to Dr. Valero and Dr. Zhang for sharing their work. Really excited and looking forward to your findings as your supplemental study progresses. So with that, let's dive right into questions. I'm just going to throw these out there, and you can rock, paper, scissors, who responds. I'll start with an easy one. How are you selecting CoCs to work with?
That's a great question. Because that was one key part of our research plan when we are kind of developing this project. So it has been, we've been very blessed to have this funding support from RWJF. So from our first funded project, we could identify highly effective CoCs. And those are with the resources for sure, right? And those are located in major cities. And those are the CoCs had large homeless populations. And at the same time, they are also located in a hotspot. Okay. So we are considering like the size of homelessness and the capacity of CoCs. At the same time, their impact, how they are experiencing this COVID-19. So that we chose these 20 plus or 25 CoCs. But at the same time, we realized there are quite challenges that has been experienced in the rural communities, especially for the providing medical services and address this vaccine hesitancy there in rural community. I mean, that's the kind of recent news report. So we are open to include other conditions at this point, to include to see which CoC that we have to sample. Thank you.
Thank you. So the next question is related to tent encampments. Has your research investigated the role of these encampments in the CoC response to the pandemic? Do you think encampments can be congruent with the existing CoC structure?
I can start to answer. Well, that's a one key issue, right? It's very complex issue, and there is no one effective approach that can address this issue, because we don't want people to stay in unsheltered conditions. And there should be some effective approach, but we don't want to clean up this encampment area, especially in the COVID-19. So there has been diverse approaches to in support of, like, in a way to address this issue, but there is no single solution yet. And I don't want to pretend that I know the answer about this very complicated issue. I don't know if Michelle or Jesus may want to add your kind of perspective about this topic.
I can certainly agree. I mean, we've seen an increase in encampments in Salt Lake, and I know many communities have. I understand some communities reduced outreach because of COVID-19 concerns about safety for their staff and others. We actually increased outreach in Salt Lake County to ensure that we were having the same resources available to people that were camping than as to people who were staying in facilities, but it continues to be an ongoing challenge. 4th Street Clinic is currently now going out to encampments to do vaccines, for example. So we want to make sure that they're included.
And Jesus, did you want to chime in on that, or?
Yeah, I think the only thing I'll add is that certainly, you know, the encampment sort of reality is part of the COC sort of process and the collaboration process. It certainly falls on, you know, COCs, local governments, and community partners to be a part of the response effort. And so we are thinking about including that as an important element of the COC work across the country, and include that as part of our both case studies and also national survey to get some understanding of the strategies that some communities are adopting in order to respond to the needs of people who are unsheltered, and in response to how to manage sort of this reality of people living in these unsheltered conditions. So certainly, yes, these pieces will be a part of our work as well.
And with respect to resource conditions, will you be looking at the gap and barriers to access services compared to the desired services from the perspectives of individuals themselves? I.e., how will peer voices be reflected? Individuals with lived experiences of homelessness and vulnerability in your research.
Great question. It's Yes, it's very important that we get to understand the reality that they are experiencing, and try not to just dwell simply with the assumptions, right? Because whenever we get to talk to the leaders of the community, and all these assumptions and previous understanding has to be changed, and that's quite an experience of our research, and that has been also acknowledged at the kind of federal level when they have these instructions for the leadership of COC. They strongly recommend to have a person who had an experience of homelessness or who are experiencing homelessness as part of their some type of committee or advisory board type of seat. So because we experience the COC is from our research quite a powerful systems that is for action, because it's not a uniform, it's not a standard form. Each of the community has its own way of developing their service network that fits to their context, because the nature of their homeless population is different. Like, for example, from our conversation, like the initial interview with COC leader there in Sarasota, they didn't experience shortage of shelter beds in the initial time of the pandemic, because the homeless population was so feared. They had a high fear of infection, and they hate to go like this, stay in the congregate setting of the shelters, because they can choose to stay in the wooded area and encampment. So that is their unique conditions and the situation that can be understood by closely connected with the people who are experiencing homelessness. So we understand that's very important, has to be part of our research effort, but we are not, we don't know what's the best way. Let me put it like that. So if you have any kind of research approach that you can offer us as a way to be connected with the people who are experiencing homelessness, we would totally appreciate that.
Okay. And are any of, based on original study, are any of the CoCs using shared data or shared technology systems to enable care coordination across multiple sectors? And have you found any lessons, barriers, best practices on what has been needed to enable care coordination across sectors?
I know that this has been an important question for a lot of communities. We haven't necessarily looked at the adoption of technology in order to increase the shared sort of information across the sectors. I know one immediate challenge has been, protected client information and healthcare agencies being hesitant towards being a part of any shared sort of network. Michelle, I know Salt Lake County maybe 2 years ago was in some conversations around how to do this. Would you be able to offer some insights on, that process or whether that worked or not for this community?
We're still in conversations around this issue. We have made a lot of progress in sharing data at points of time, but live sharing of data, we have not been able to tackle yet. But that is, we're working on, right now there's a committee looking at the statewide opportunities to share HMIS data in a way that's very specific towards increasing the knowledge of the case managers and folks who are working directly with people experiencing homelessness to just help them get those resources to folks more quickly.
And I may add, so each of the community has their own agreement among different, like the service providers, like Jesus said, there's a medical service provider have their own restrictions in a way of sharing their information with other service providers, like the shelters, but at the same time they have to coordinate to serve these homeless patient when they are discharged from the hospitals, not to discharge them back to the homelessness, but to the proper shelter location with proper medical service capacities. So if some of COCs and community had more like it's tighter and solid information sharing system, and some of COCs and communities are struggling to build this type of information and system that has to cover very distinctive service industries of the shelters and medical service providers and the services for the veterans. So we are not saying there is a one way that we observe about the way they share the information, but we are saying there is quite well coordinated communities compared to some of communities are struggling.
Okay, thank you for those responses. I think we have time for one more question. If that's all right with presenters. So What approaches have you identified that effectively deal with the increases in folks experiencing behavioral health crises, particularly behavior associated with increased risk of overdose death?
Michelle may be the great person to respond, right?
I know, I don't know that that's been part of your research study. It's certainly a really important issue and probably deserving of its in another entire webinar. But I think the most effective approach is definitely having something like an ACT team, so an assertive community action team that is consists of a specific series of individuals, so medical doctor, mental health support individual that is able to work very closely with people who are in this high risk category. So often mental health and substance use can often be co-occurring, and it's really important to have all those people around the table with the focus of getting someone into their own home as quickly as possible, and then providing those services to wrap around, because people who are at risk of overdose are at great risk while they're unsheltered. And so that really is the key to get people into a safe location.
Okay, I know I said that was the last one, but if you don't mind, I'll direct one final one to the research team. How much of COC decision-making processes are driven by individual leaders versus backbone agencies?
That's a great question. That's a great last question. I should say that, because that is one of the key research topic that we had from our previous RWJF funded study to understand the decision-making, governance, and leadership of COCs. And there are like variety of governance like the models, and some of COC is shown like it shows kind of very centralized decision-making mechanism that is focused to the COC, like the standalone non-profit organizations. And that's one of the example is Dallas COC here in Texas. And there are some other type of COC leadership mechanism that is shared by key service entities, led by one facilitative leader, that it could be the county or the COC. Like for example, like I believe Salt Lake County, where Michelle is part of, is more of the shared governance, because Michelle, as a kind of major shelter service provider, take a serious leadership, and that is shared by other key actors. So yes, so that I can say about that, and Jesus can answer this question quite nicely too.
Yeah, and so, so those are some of the various models of governance of some of the COCs. We've started to dig into what type of models are more effective in leading some of these collaborative efforts. And one of our more recent publications shows that COCs that are led by nonprofit organizations, perhaps a little controversial, is that they're less successful in securing federal resources than those COCs that are backboned or led by government agencies. And there's some interesting sort of reasons there why, potentially resource constraints, challenges, and capacity of nonprofit organizations to be in those leading roles. But we're continuing to explore more of these questions of what governance arrangement is more effective in terms of leading some of these collaborative efforts, and we'll be happy to share more of those results as we complete some of this work. But that's a great question.
All right, and thank you for the great responses. So we'll extend a virtual round of applause to our presenters today. Thank you, Jesus. Thank you, Yusun, and Michelle as well for your commentary. We'll be sharing all of these slides afterwards via email, and be sure to keep tabs on this group on our website as well. If you want a certificate of completion after today's ResPAR webinar, there's a survey at the end. Please complete that. We'll also email everyone. And we have a new funding opportunity. Looking for, so we have $2 million available to measure solutions to the wrong pocket problem. So if you're interested in learning more about this funding opportunity, check it out on our website, systemsforaction.org/funding opportunities 2021. We also have a recording of an informational webinar, so you can get some details about what applications will be the strongest, and be on the lookout for an invitation to our next informational webinar, which will be scheduled soon. So thank you again to our presenters, and thank you for everyone who was able to join us today. Hopefully we see you next time, Research in Progress webinar, April, next slide, April 21st. All right, and with that, enjoy the rest of your day. Thank you.